that, Mr. Sakamoto Wengo, I'll turn it over to you.
Chairman, members of the committee, I'm Steve Sakamoto Wengel, one of the deputy chiefs in the Consumer Protection Division, Office of the Attorney General, and here to tell you a little bit about the Consumer Protection Division today. With me is my law clerk, Elizabeth, who is going to be helping me with the presentation. So I guess you can advance the slide. Here's my contact information if anybody needs it, or if you have consumer issues that come through from your constituents or any kind of consumer related bills that you're interested in pursuing, please feel free to contact me. So let me tell you a bit about the Consumer Protection Division, which since I started there 36 years ago, has grown in size and responsibility quite a bit. Basically, we're responsible for enforcement of the Consumer Protection Act in the commercial article, but also for quite a number of related laws which are designed to protect consumers against unfair, abusive, or deceptive trade practices. The CPA was first enacted in 1967, and it's really our responsibilities have grown quite greatly since that time. And I just want to, the first Attorney General I worked under was Steve Sachs, and what he used to say was that the Consumer Protection Act allows us to stop businesses that are engaging in deceptive trade practices, but that helps, the businesses that aren't, engaging in those deceptive trade practices. So there's, so the fact that, we on occasion could be considered anti-business. It's not because we believe that, by restricting deceptive practices, then we, are helping the businesses that aren't engaging in those practices. So the Consumer Protection Act prohibits unfair, abusive, or deceptive trade practices. And deceptive trade practices include misrepresentations, omissions of important information, or violations of various other statutory provisions. So there are some that involve the method of sellings. There's the Door-to-Door Sales Act, the Layaway Sales Act, Telephone Solicitations Act, Maryland Telephone Consumer Protection Act, and those tend to put restrictions on selling by those methods. Some that deal with the type of transaction. There are laws dealing with work-at-home offers, automotive repairs, automobile warranties, vacation club memberships, condominium sales, hearing aids, or intrastate household moves. Or there are laws that apply to the conduct during the transaction. For example, can't require a telephone number in order to accept a credit card, or requesting a credit card account number in order to accept a check. Some misrepresentations, and it's kind of a broad concept, but includes falsely disparaging, or misleading oral or written statements, visual descriptions that would have the capacity, tendency, or effect of deceiving or misleading consumers. The Consumer Protection Division doesn't have to show actual harm, and we don't have to show intent in order to find a violation. Other examples of deceptive practices or representations that consumer goods, consumer realty, or consumer services have some kind of sponsorship, approval, or characteristic that they don't have. Sometimes if somebody says, we've been approved by a certain agency and they haven't, that would come under that provision. Or you can't advertise or offer consumer goods, consumer realty, or consumer services without the intent to sell them, lease them, or rent them as advertised or offered. We also take action against material omissions, and that's failure to state a material fact. Failure deceives or tends to deceive consumers. And a fact is material if it would have been considered by the consumer in making a decision whether to purchase an item. We also prohibit unfair practices, which are not necessarily the same as deceptive but can overlap. A practice is unfair if it causes substantial harm, it cannot be reasonably avoided by consumers, and does not benefit the marketplace or consumers. And some examples of unfair practices are failing to deliver promised goods or services, selling illegal goods or services, or selling or marketing unapproved new drugs. So we've taken action where, for example, drug manufacturers have been promoting drugs for off-label uses, which they're not supposed to be doing. Abusive practices were added to the Consumer Protection Act as part of the Financial Consumer Protection Commission that was established several years ago and came up with recommendations. And an abusive standard is whether practice materially interferes with a consumer's ability to understand a product or service, whether the practice takes unreasonable advantage of consumers. And when that bill first passed, then Attorney General Frosch gave the example of the elderly consumer who doesn't drive, but is convinced to be taken to a car dealer to purchase a car that he doesn't need and can't afford. And that may not be a deceptive practice, but it would be an abusive practice because the car dealer is taking advantage of the vulnerable consumer. Go on to the next slide. So the Consumer Protection Act applies to consumer goods and services. And a consumer is an actual or prospective purchaser, lessee, or recipient of consumer goods, consumer services, consumer realty, or consumer credit. And those terms respectively mean credit, debts, obligations, goods, real property, and services, primarily for household, family, or agricultural purposes. So that's basically how we look at what is a consumer transaction. As Delegate Howard is aware, we don't handle business-to-business transactions, and we've although we do get sympathetic businesses, small businesses who do complain to us, but we don't have jurisdiction to really help them. We have been able to intervene and help some small nonprofits that have been taken advantage of, but generally we just don't have the resources to handle complaints between businesses. So generally it applies to merchants, and that's a person who directly or indirectly either offers or makes available to consumers any type of consumer goods, consumer services, consumer realty, or consumer credit. And merchant includes a person who directly or indirectly purchases or offers to purchase any consumer goods or consumer realties from a consumer. And those were the we buy houses, we buy cars folks who were engaging in deceptive practices in those transactions. Initially, it only applied to the sale of consumer goods. So when the deceptive practices were engaged in people buying those consumer goods, that wasn't initially covered, so that the act was amended to include those types of purchases. And also whose business includes paying off consumer debt in connections with the purchase of any consumer good or consumer realty from a consumer. So that would be the we buy houses folks. Okay, there are certain exemptions, and those exemptions does not apply to the professional services of CPA, architect, clergyman, engineer, lawyer, veterinarian, insurance company or producer authorized to do business in the state, therapist, medical, or dental practitioner. Now the focus there is on professional services. So for example, if you're talking about a doctor, if the doctor is examining patients and prescribing medications, those are professional services. But if a doctor's advertising, if a doctor's billing, those would not be considered professional services, and we could take action against that individual in those types of situations. The Consumer Protection Act also doesn't apply to a public service company to the extent that that company's services or operations are regulated by the Public Service Commission. So the Public Service Commission they regulate landline telephones, but they don't regulate cell phones. So if there are complaints against cell phones, those would come to us, not the Public Service Commission. And we also, it doesn't apply to the television or radio broadcast station or the publisher or printer of, print of advertising that's unfair and deceptive unless the broadcaster or publication had some kind of role in the deceptive practice. Okay. Most of the complaints that we receive come to our mediation unit. And our mediation unit received over 9,400 consumer complaints in FY 2022, nearly 29,000 calls and emails. The Baltimore office is staffed. We have by a director, it's an assistant attorney general. So I have a deputy director, 4 supervisors, 3 support staff, dedicated cadre of volunteers and interns work to resolve consumer complaints through mediation. We used to have a pretty significant group of interns, of volunteers, and primarily retired folks who did a great job, in trying to resolve consumer complaints. Unfortunately, the pandemic, reduced the number of folks volunteering. But we still have a handful right now, and we're trying to build up, the staff again. But it's been great and really has accounted for, the staff that we don't have. So, and in FY 2022, the mediation recovered more than $2.2 million from Maryland consumers. So, and these are resolved through mediation. So, if you do have concerns from a constituent, we encourage them to file a complaint with the Consumer Protection Division, so we can A, try to resolve it, and B, have a record of what's going on out there. In addition to our main office in Baltimore, we have offices that mediate consumer complaints in Prince George's County, where we have 2 supervisors, plus we have volunteers there as well. We have an office in Hagerstown, which has 2 supervisors. In that office, staffs Frederick and Cumberland part-time. And we have an office in Salisbury, and there are 2 supervisors in that office. Next is a list of the top 10 industries that we had complaints against in 2022. And number 1 was landlords and property managers. Then we had used in new auto dealers and auto manufacturers. The next one is interesting, government agency. And you might wonder why we get complaints against the government agency. Well, when there were all the problems with the unemployment insurance during the pandemic, and people were not able to get through to the Department of Labor, calls came to us because we were answering the phones. And even though we had no jurisdiction over unemployment insurance claims, we tried our best to assist people and tried to put them in touch with folks over at Department of Labor that could actually help them. Now, with respect to the unemployment insurance fraud, where people were filing unemployment claims in other people's names, including mine and several other staff in the Attorney General's office, those our identity theft unit was helping people get those straightened out. But as far as I can't get my unemployment insurance and what's taking so long, that unfortunately we didn't, even though we got a lot of calls about it, we couldn't handle those. The top 10 practices that were reflected in those complaints, the number 1 was failure to honor a request for a refund. Then we had unsatisfactory service, habitability or maintenance. This is a lot of the landlord-tenant complaints, defective or damaged goods, failure to honor cancellation requests, failure to deliver goods and services. And so those are some of the complaint practices that we've been receiving from consumers. Common ownership communities. These are condominiums, HOAs, co-ops. There is no statewide agency that oversees common ownership communities. Some counties, Montgomery County, Prince George's County, and Charles County, do have common ownership community agencies that help resolve complaints about common ownership communities, but there's no statewide agency. I think as Delegate Wyvil is well aware from his time on the Housing Subcommittee of E&T. So those complaints tend to come to us, and we try to resolve those complaints. We are able to try to address complaints when they violate the Condo Act or the Homeowners Association Act or the Co-op Act. We are not able to assist consumers if they have issues with the association's bylaws, or other documents that aren't violations of the law. But we do get quite a number of complaints, and some of those get pretty messy. So that's an area that I know is in need of some kind of regulation, and we'll see where that goes. We also have a Health Education and Advocacy Unit, and this was actually first formed in 1986, and they assist consumers with healthcare-related complaints, including when your insurance company denies a claim for covered services. We assist consumers with filing appeals and grievances with the insurance company or the Maryland Insurance Administration. We address medical billing disputes. We address illegal charges for obtaining medical records, address problems with medical equipment such as wheelchairs and hearing aids, obtaining financial assistance from hospitals, and issues with obtaining coverage or premium assistance from the health benefit exchange. So, and our Health Advocacy Unit has been working closely with Delegate Charkoudian on hospital debt collection and issues. So we appreciate that. The HEAU also serves as the consumer representative on many health-related boards and committees. And they weigh in on federal and state health legislation and regulations to ensure the interests of healthcare consumers in Maryland are represented. So don't see them that often in this committee, but they're regularly in HGO down the hall. Last year, the HEAU handled nearly 2,000 complaints, and they helped patients recover or save over $2.3 million. 436 of those were appeals and grievance cases mediated by the Health Advocacy Unit and resulted in 65% of medical necessity decisions and 56% of contractual coverage decisions, 74% of eligibility denials being reversed or modified by the carriers. So we think that is a pretty good record. Also received over 5,200 calls and 1,600 emails from consumers with inquiries or seeking assistance. The HEAU has a director and deputy director, both assistant attorneys general, 5 ombudsmen, 1 part-time, an administrative assistant, and we also have volunteers and interns in that unit who assist consumers in resolving their complaints. And there's an annual report of appeals and grievance complaints that's filed with the General Assembly, and that report's available on the Attorney General's website. Our enforcement unit. So 99% of what we do is handled through our mediation unit, and that's where complaints are resolved and try to address them through mediation. However, if the division receives a large number of complaints about a business or practice, or we identify a particularly egregious practice, then the matter may become an enforcement action. And the division brings some enforcement actions on its own. We also bring a number of actions jointly with other states who are experiencing the same deceptive practices being imposed on their consumers. In enforcement action, the division is able to obtain injunctive relief, which prohibits future unfair, abusive, or deceptive conduct. We can get restitution and damages for injured consumers, civil penalties, and then we can get the costs of investigation and prosecution awarded. The enforcement unit also includes subunits. We have that concentrate on cases. We have a housing subunit that focuses on landlord, tenant, and mortgage fraud cases. Complex financial transactions unit that includes predatory lending and deceptive debt relief practices. Health fraud unit that includes marketing drugs for non-approved uses. And I have some examples of recent enforcement actions. You may have heard of the Westminster management case. It was a landlord that operated quite a number of complexes in the Baltimore region. And there were significant complaints about the conditions of those properties. So we filed suit against them. There were also, fees that they were charging that they're not allowed to charge in Maryland. So we recently agreed to a settlement that, they agreed to injunctive relief, including the requirement they reasonably maintain more than 9,000 rental units in 17 residential communities in Baltimore City, Baltimore County, and Prince George's County. They also agreed to pay restitution of the illegal fees they charged, and there's a claims procedure that allows tenants who lived in the properties that were poorly maintained to recover their rent payments. And the final order also imposed penalties of more than $3.2 million. Another enforcement action, and this is one of the multi-state actions that we brought jointly with other states. This involved Navient, which is a student loan servicer, and it was one of the largest student loan servicers in the United States. It resolved allegations that they steered students into loan forbearance options that added to their debts, were not in their best interest, and that they originated predatory subprime private loans to students who attended for-profit schools and colleges that had low graduation rates, even though they was aware that a high percentage of those borrowers would be unable to repay the loans. They agreed to forgive more than $1.7 billion in subprime student loan balances, make $95 million in restitution payments, and there are more than 1,100 Marylanders who are be relieved from having to pay more than $34 million in student loan debt. And there are 11,836 Marylanders who also received restitution payments totaling more than $3 million. So that was a pretty helpful enforcement. Cash and Go, we entered a final order against Cash and Go, which is a company that was making unlicensed consumer loans, interest rates up to 360%, and they were ordered to pay more than $2.2 million restitution to Maryland consumers and $1.2 million penalty. And this was a case that we work cooperatively with the Commissioner of Financial Regulations Office. You heard from the Commissioner this morning. This is one of those predatory lenders that we're talking about. The final order has been confirmed by both the Circuit Court and the Court of Special Appeals, and both reviewing courts rejected Cash and Go's argument that their loans were pawn transactions rather than consumer loans. And we've had several payday lenders who have tried to come up with clever schemes that to pretend that they weren't really engaged in lending when in fact what they were doing were payday loans by another name. We found that at least 1,600 Maryland consumers were victimized, and the court also affirmed the division's imposition of a penalty of more than $1.2 million in addition to the restitution order, because the company and its owners have been repeatedly warned their conduct was illegal but continued with that conduct. Another enforcement action, this is another multi-state enforcement action, involved Santander consumer lender, and this was in subprime auto lending practices. They're accused of making auto loans to consumers that were likely to default, resulting in repossession of the consumer's vehicles. They agreed to reform the way they offered financing to consumers. They're barred from requiring their dealers to sell gap insurance. Gap insurance, for those of you who aren't familiar with that, is when you first buy your car and then you drive it off the lot, it drops in value. So if you end up totaling that car early on, the insurance company is not going to pay you the cost for replacing that vehicle. So gap insurance covers the difference between what your insurance company pays and what the car's what it costs to replace that car. They also agreed to more than $500 million in debt relief, and including for more than 1,000 Maryland consumers who received waivers of $13.7 million that owed to Santander. And more than 9,000 consumers were also entitled to receive restitution payments totaling more than $2.2 million. And they paid Maryland civil penalties of $585,285. Another action involved Coons Kia, which was accused of misleading consumers when they advertised prices that failed to include added fees, and they separately charged consumers for freight when the freight charges were already included in the advertised price. So they returned nearly $1.3 million in restitution and paid the division $100,000. Another enforcement action, there was multi-state, involved Career Education Corporation, and this was one of the predatory for-profit education companies. Under the settlement, they'll forego collecting more than $8.5 million in debt owed by 2,784 Maryland students. Nationally, they agreed to pay more than $493 million in outstanding loan debt. And they need to significantly reform their recruiting and enrollment practices, and made a $5 million payment to settling states. We received $264,000, but there's a problem with a lot of the for-profit schools that promise you that you'll get a good paying job and in the career of your choice, and 9 out of 10 times that's not what happens when you enroll in one of those schools. So even though we're not DLLR, legislature has given us several registration units that we operate. We register home builder and home builder sales representatives. And as of the end of FY 2022, there were 2,550 builders and 751 sales representatives who are registered with the unit. We also now administer a guarantee fund for consumers whose home builders fail to correct defects or have other problems with the new homes. We have a health club registration unit, which requires all health clubs, weight loss centers, and self-defense schools to register. This one is near and dear to my heart because when I was first hired into the Attorney General's office in 1986, the health club unit was my bailiwick. Those health clubs that collect advance payments from consumers or who collect any money before they open have to give us a bond or letter of credit to protect those consumer payments in the event they go out of business or never open to begin with. As of the end of the 2021-22 registration year, there were 416 businesses that were registered. 80 of those had posted bonds because they collect advance payments from consumers. We also have a structured settlement transferee unit, and this deals with the situation where tort victims, enter into settlements where they're getting a structured settlement that's paid over time, and particularly this applied to lead paint victims, including Freddie Gray, who was a victim of this, and the structured settlement transferees would purchase them for pennies on the dollar. They would provide them with financial advice from a connected representative, and there were other practices that were deceptive in getting folks to enter into these structured settlement sales. So this now requires them to register with our office, provide us with information about the sales, and it provides stricter standards that the courts have to apply before approving the sale of a structured settlement. The reports were at the time that the circuit courts were just rubber stamping these agreements without really ensuring that they were benefiting the consumers transferring those. We have an identity theft unit that helps consumers who are victims of identity theft. We also, that unit is where reports of data breaches are reported by companies that are victims of data breaches. We had over 1,400 data breaches reported to the unit in FY 2022, and we ensure that those victims get timely notice of the breach. And we also provide those victims with information on how to protect their personal information. We also assist consumers who are victims of identity theft with helping to clean up their credit records, and we provide ID theft passports to victims that they can use when dealing with a creditor or even and sometimes with the police to show that that bad debt or the crime on their record was the result of identity theft. And we assist a large number of those consumers who are victims of unemployment insurance fraud with trying to protect their information. We also help consumers place and remove freezes on their credit reports or on their children's credit reports. And we highly recommend freezing your credit, unless you're going to be going for a mortgage or an auto loan. But that helps prevent identity theft, because when somebody goes to inquire about opening a credit card or taking out a loan in your name, and your credit's frozen, the credit reporting bureau said, sorry, I can't give you that information, and that kind of provides a signal to the creditor that maybe we don't want to issue this credit to this individual. We also make regular public appearances to educate consumers about how to protect your personal information and how to avoid becoming a victim of identity theft to begin with. And I forgot to mention, I'm really proud that the Maryland General Assembly was one of the first in the nation to authorize children's credit freezes. Even though children aren't supposed to have credit reports and can't open up credit in their name, people with access to their information, and since they have clean credit records, they have taken advantage of using their social security number to open up credit in the children's names. So we created, with the help of the Maryland General Assembly, one of the first in the nation children's credit freezes, where a parent can freeze their children's credit report up to the time they turn 18 and are able to obtain credit on their own. We have an opioids unit that deals with the folks who help get people addicted to opioids all across the country. And we litigate actions where we seek equitable and monetary relief against a variety of actors, including manufacturers, distributors, marketers, and sellers of prescription opioids. We believe that the conduct violated the Consumer Protection Act. We were actively involved in the Purdue Pharma case, which you may have heard of, and that case ultimately settled, but not until we had filed an appeal of the fact that the court was willing to give the Sacklers a free pass. And after we won that appeal, the Sacklers agreed to pay much more money than they had originally done. Other matters handled by the unit, and generally we're working along with other states, have resulted in nationwide dispositions worth more than $40 billion, and it's expected to provide at least $785 million to the state's opioid restitution fund over 18 years to try to help abate the opioid crisis here in Maryland. And we work also with local jurisdictions in trying to address those issues. We have an education unit, a one-person education unit, but they prepare educational materials for consumers. We believe that educating consumers about their rights helps to prevent many problems from occurring in the first place. And I brought some examples of some of our more popular brochures: our landlord-tenant guide, our identity theft guide, consumer guide from Maryland, and a guide on nursing homes. Unfortunately, I can't give you copies of these right now because these all have Attorney General Frosch's name and picture on them still, and we're reprinting them with Attorney General Brown's name and picture. But if you want to go to our website, www.marylandattorneygeneral.gov, the updated brochures are available there, and you can read them online or download them or print them from our website. Additionally, we arrange speaking engagements for representatives of the division. And during non-pandemic times, we've provided outreach at events such as the Maryland State Fair and the Senior Expo. So if you're interested in having somebody from the division come speak to some of your constituents or at one of your events, please let us know and we'll be happy to try to provide somebody. We've been trying to do a lot of talks about senior scams because those have been quite prevalent. Grandparent scams, or the IRS is calling you and pay us in gift cards right away or else we're going to come haul you off to jail. And unfortunately, a lot of folks fall for those. So during the pandemic, we were able to conduct live and online presentations across the state. So that's but that's really important. We really think we like to be able to educate consumers. We have a senior asset recovery unit, which is unique, and this is the result of legislation passed by the Economic Matters Committee in the General Assembly in 2016. Normally, we don't represent individuals. Our actions are brought on behalf of the state, not on behalf of individual consumers. This is one case where it made an exception and where vulnerable adults and senior citizens are victims of financial exploitation by a caregiver, by a relative. We're able to assist them in trying to recover the assets that were taken as a result. And since the program began in 2017, we've been able to recover more than $530,000 for victims of financial exploitation. And there I have the information to contact the attorney who's working on that program. Name is Pilar Rodarte, and her contact information is there. So that's the overview of the Consumer Protection Division. I'd be happy to take any questions, except from Delegate Arentz. No.
Steve, thank you so much for the brief. We'll go to Delegate Harrison was first.
Thank you. Thank you so much. This was really some great information. I really do appreciate it. And I had two questions.
Sure.
One, you mentioned early on that you don't handle business-to-business complaints.
Correct.
So where do those who handles those?
Unfortunately, there really is no agency that handles those types of complaints. The Better Business Bureau will do some business-to-business complaints, but there is no state agency that handles those. I guess the thinking was that most business, even though it's not always the case, most businesses have the resources to be able to hire their own legal counsel and bring their own actions. But we do not have adequate resources to handle business-to-business complaints in addition to what we handle now.
And the second question is, how do you go about finding your interns and volunteers?
Well, the volunteers, a lot of it's recruitment through word of mouth. People who volunteered from our offices, will bring their friends in. We also, do presentations, at senior centers and other places, and we get volunteers there. We get interns from the law schools, and we get interns from colleges in the area. So, and we train them on how to mediate complaints and give them a general overview of the Consumer Protection Act and what it provides.
Are you going out and recruiting them, or are they? Yes. Is it through the university?
Well, we have contact with the university, and we receive a certain number each semester. But yeah, and but we also then recruit the volunteers, and so.
Thank you.
Sure.
Delegate Arentz.
Mayor Steve, good to see you again. Yeah. Just to go over something we talked about in the past, but what's a reasonable expectation from your department when I send you a request about a circumstance, let's say a violation of what I believe to be the Consumer Protection Act? What's a reasonable expectation on my part?
Okay, well, I mean, initially, what we would likely do when we receive a complaint from you or from any consumer, we would look at it in the mediation unit. Although if we do think that it involves a practice that might warrant enforcement, then that will be sent over to the enforcement unit for investigation. And and they will make a determination, given if we have adequate number of attorneys to bring it, to file an enforcement action against that business. So, but we clearly don't have enough staff to bring all the enforcement actions that, deserve to be brought.
In my case, and you're familiar with my case, when I ask you to look into something, how do I know where it stands?
Well, if we're mediating a case on behalf, we'll keep you informed of where that is. However, like most enforcement agencies, we can't comment on investigations, including whether we're conducting an investigation, because, in the event that, we decide that there's nothing there, there's no there, we don't want to be, doing this out in the public eye.
Okay, how long will it be before I know that there's no there there?
It varies with each investigation.
You know my reason. I'm
I
asking. So,
understand, yeah.
And again, this is something I think we should have a longer conversation at some point about, as far as when a delegate goes to a department to ask a question, there should be some expectation that they will be kept in the loop. They will be updated on the status of that, because I put in information or ask a question because I'm being asked the questions, and when I have no recourse and no way of knowing what's going on with it, I just sit there and stutter for days. So, but I think it's something we ought to review and have another look at, maybe as a committee on that. I appreciate your interest. Thanks, Steve.
Thank you, Delegate.
Delegate Charkoudian.
Thank you, Mr. Chair. Just my mic's on. I just got to warn the people around me that they shouldn't make the comments now. I really appreciate the presentation, and I appreciate the extraordinary work you do. It's just such a wide range of areas that you protect consumers in. I have one sort of maybe more specific and one broader question. I'm interested in just where you're, with all of that work that you're doing, where you think what policies we need to be looking at. And I'm sort of interested in, if you know already what the priorities of your division are going to be that you're going to want to ask us to consider this year. I'd be interested in hearing a little bit about that. And either way, are there larger issues that are sort of on the horizon that might be a couple of years of policy development, but that are coming up in this kind of broader, consumer protection arena that we might want to be starting to think about, maybe longer term issues? So kind of this session and then other things we should be paying attention to.
Well, I know that one area that we will be pursuing this session, and we pursued it in past sessions, is involves price gouging. And Maryland, unlike 30 other states across the country, has no law against price gouging. And so when we get complaints from consumers that either the gas station is jacking up prices without any basis for doing so, or we have a hurricane that strikes southern Maryland, and the contractors are all doubling and tripling their prices, that we really can't do anything to help those consumers because there is no price gouging statute in Maryland. So once again, we will be trying to enact a price gouging statute. There was temporarily a price gouging statute that was enacted during the pandemic that expired, but we were able to resolve those complaints mostly through mediation, contacting the businesses and getting them to either show us there was no price gouging or to address that and change their prices if in fact what they were doing was price gouging. To the best of my knowledge, the world didn't come to an end when we had a price gouging statute in effect, so hopefully the General Assembly will take that into consideration when considering that. There are always new and different ways of engaging in predatory lending that we're going to be addressing, and that as always continues to be a growth industry. I know there was also during this morning's briefing by the commissioner some discussion of cryptocurrency, and to the extent that those businesses are engaging in deceptive practices, that might be something that we'll be looking at and dealing with in the future. Additionally, I know that the Securities Division of the Attorney General's office has been taking action against folks who are unregistered but selling cryptocurrency as an investment. So those are some of the issues that, we foresee on the horizon.
Thank you. Appreciate it.
Thank you.
Delegate Chi.
Thank you, Mr. Chair. Mr. Sakamoto Wengo, good to see you again.
See you, Delegate.
I was going to ask you one question, but Delegate Charkudian's question prompted me to think we do need to have some statute, and I'm glad to hear what you just mentioned about price gouging, because I got some complaints from my constituent about exactly the situation we're talking about, which is gas station price gouging. My question is about financial advisors. If a consumer feels she has been cheated by her financial advisor and lost a lot of money, would they have to go to the Office of Commissioner of Financial Regulation, who just gave us a briefing this morning, with oversight, or would it come to you first?
I would think that would either come to the Commissioner of Financial Regulation or to our Securities Division, especially to the extent that they're giving financial and investment advice. Investment advisors are required to be registered with the Securities Division at the Attorney General's office. So,
Okay, thank you.
sure.
Delegate Howard.
Thank you, Mr. Vice Chair. Steve, good to see you. Thanks for coming
Good
out
to see you.
today. Hey, the Cash and Go, how long were they in operation until they were shut down?
Don't remember exactly, but they were in operation for several years, and they were giving out, they were using title loans, but they were claiming that they were actually pawning your automobile title. The commissioner advised them they can't do it. We advised them they can't do it, but they kept on going. So,
And it was what, 360% in some
Yeah.
cases? Yeah.
right.
$1.2 million in restitution.
Right.
How much money did they make over that time period of the investigation that they were in business?
I don't know, but I think, but whatever they collected from consumers in Maryland, they were ordered to return,
All of it?
all of it.
Excellent. Thank you.
Sure.
Delegate Adams.
Thank you, Chair. So you just said cryptocurrency, and I asked the question earlier, you may have been in the audience.
Right.
So you're the department that actually gets these complaints when people get taken advantage of or get stuck. So could you tell me a little bit more about that?
Well, like I said, some we can handle. I mean, there are some, where, in fact, there were deceptive practices involved in the sale of cryptocurrency, either about how secure it is or, how much it's going to appreciate in value or, things of that nature. Or maybe there might be deceptive practices involved in, saying, you can use this for black market stuff and won't get caught. Those are all deceptive practices. So to the extent that, there are deceptive practices involved in the sales, those are things we would be able to get involved in. Like I said, our Securities Division would address it where it's involved, as an investment. But, the commissioner and, the feds would oversee it as far as where it's being, the exchanges where, you're buying and selling and trading cryptocurrency, that those would be overseen by the financial regulators.
So my comment is thank you for your participation in that. While I have the microphone, I have another quick question. This
Sure.
Health Education and Advocacy Unit, HEAU.
Yes.
So what I'm hearing, and I actually was on the phone today with a constituent, family business, so a family practitioner, where they're having difficulties getting reimbursements from health insurance companies and Medicare. So the question is, do you get complaints from the providers? I'm not talking about consumers, but frankly, the providers who are probably dealing with the same sort of thing. This provider who talked to me said that they're going to end offering services that are being reimbursed through some local companies that we have to do business with, but also Medicare. And they're saying, okay, we're going to do business with you, but then you have to deal with the insurance company. You have to deal with Medicare. And I assume that what you're dealing with on your level is those customers who deal with the health insurance companies then have to deal with the same problems these family practitioners have. So my question is, are you getting calls from these family doctors who are saying, I'm done?
First, we don't have jurisdiction over Medicare and Medicaid complaints. Those we're not able to handle. But we do have, it's not directly the practitioner, but we do have a provision that allows practitioners to file complaints where their patient has been denied coverage by the insurance company for a procedure. So the practitioner can file that complaint on behalf of their patient.
I mean, at some point, that's going to be a reckoning in our state, because this is not the first time I'm hearing of the complaint where providers are doing the work in the anticipation of being compensated, and they're being flatly said, we're not going to compensate you, or we're going to cut your compensation by 40%. Absolutely not in our committee jurisdiction, so I don't expect it'll be something that I would bring a bill on. But at some point, we need to stand strong with the business model that we have, which is access to care. Consumers need to be able to go to a doctor and not let these doctors either retire or leave the state because of a structural problem with how the insurance companies and Medicare are doing business. So thank you.
Sure. Thank you, Delegate.
All right, seeing no more questions, Steve, I want to thank you for all that you do and coming here today, provide the brief. It was
My
very
pleasure.
informative, and thank you for all the work you're doing, not just on behalf of us, but on behalf of all of Maryland. So that concludes today's briefings. See everybody tomorrow.
Good job.
Thank you. You as well.
I'm having dinner. So.